Hi, I'm Kara Richardson. I'm one of the PAs here at Premier, and we're going to do a demo on Miss Carol, who's a sweetheart, who we have done a few procedures in the past, but today what we're going to focus on is treating her jawline. So, like all of us, as we age, our chin, as I always say, sort of starts to sink into our neck, and we don't have that crisp jawline that we liked when we were younger. So for her, we're going to build her chin out a little bit, and then we're going to give her a little support back here to not only help this little jowly area, but some of this laxity that we see in the lateral neck, okay? So we're going to do it with filler. So we're going to put some hyaluronic acid. There are certain fillers that are good for bonier structures, support, like areas of support. And then there are fillers that are good for soft lips around the eyes, which we were going to treat her lips today, but she actually has an upcoming appointment with the dentist, and so we prefer that any injections around the mouth area, and especially in the lips, not be done within 2 weeks prior to a dental appointment or after a dental appointment. So we're going to wait on those and do it at a later date, okay? The other thing that we're going to do is also treat her with just a little touch of Botox, not a whole lot. We're going to treat around her eyes. Can you smile big for me, Carol? And then wrinkle your nose also, Carol. There you go. And then we're going to treat these little, what we call bunny lines. And the reason we're doing that is when you smile, you pull on the lateral, which creates the little lines that sort of start to go down our cheek. But we also start to, over time, smile a little bit with our nose, which creates these little lines closer to the eyes. And we're going to reduce some of that crankiness. Yeah, right there. That's exactly. And then the last place we're going to put a little bit of Botox in her is in her neck. So we're going to actually put in these little bands, which are called platysmal bands, some Botox to relax this pulling that's happening underneath her chin to hopefully reduce some of this crankiness and allow a little bit of lifting on that part of her neck. Okay? So we're going to get started. Questions from the audience today? Okay. All right. So let's start with set her Botox. Yeah. There should have been two. You already know. Just know it's going to be perfect. So I'll start over there. So on our Botox, what we do is a little bit of ice first, okay? So Miss Carol, I'm going to put some ice on you.
Okay.
You tell me.
You know I'm tough.
I know you are. You are tough. And I want you to smile big for me.
My lips are numb.
And relax. Little pinch. So Botox is just a couple of little injections. They do not hurt much. There's really no downtime. They'll look like little bee stings, usually for a very short period of time of maybe 20 to 30 minutes, and then that'll go down, okay? Are you okay if I just do your nose?
Oh, yeah.
Okay, so I want you to wrinkle your nose up for me. There. Little pinch. Alright. And that's it on this side. So I'm going to come around and do the other side. I actually may have to wait on Jordan went to get us some more.
Did it burn going in?
No, I didn't. I honestly did not feel it at all.
So you did two on the side here and one right
and
there.
then just one right here on the nose. And we're going to do the same on the other side, okay? Well, as soon as she gets here with the rest of it.
What did she do right here?
This was her Botox, so when she smiles to help reduce those little smile lines. Yes. Thank you, Jordan.
15 years ago I had to do my forehead.
And now we'll do the other side. Okay, so smile real big for me, Carol. And relax. Little pinch. And smile again. And relax. Alright, and then wrinkle that nose for me. You did it. Little pinch. It is very hard to make expression on command, so not uncommon that we have to do it more than once. Okay, so on your neck, you actually do not have to do much at all. Just lean your chin up, yep, just like that. And these are the little bands, and on her, I can just grab them. Sometimes we have to make a certain movement, but her, we can just grab. Little pinch. It looks like it hurts, but it really does not. Neck is not very sensitive at all. Okay, and then we're going to do this side. We're going to grab. And that's all she needs. So sometimes we need to do more. I have quite a bit of Botox in my neck for a different reason than Carol, who we were trying to reduce some of that crepiness. Mine is because I wasn't given or blessed with a long neck, so I have a lot of Botox to help that release some of that cooling down so that it elongates and helps my jawline. So that's going to be a common thing that we do. I'm actually doing that at the next demo because that's her problem, is that she just has a much shorter neck and we're trying to give it some length. Okay? All right, now we're going to work specifically on her chin and her jaw. Okay? So we're going to start with her chin.
Is this Botox or filler?
This is filler. So this is actually Voluma, which, like I said, is a hyaluronic acid. It's one that's made for the structural type support. So in a chin, especially, this is a beautiful product.
I'd
Okay.
like to have that right in your hand.
Around to the other side, Kara.
Okay. I'll wait on you. All right, Miss Carol. Here we go. Little pinchy. And then pressure. You feel a lot of pressure with these along the jawline and chin. But after we do a few injections, the lidocaine that's in the Voluma will actually numb her to where she doesn't feel all of them. Yeah, you can see it coming out.
How long does it last?
It's going to last in Voluma typically 12 to 18 months. Okay? Most people are not going to let their filler go all the way away. That's the other thing. You know, we say 12 to 18 months, but at 12 she may just want to touch up just so that things don't go all the way back. Okay, here we go. We're going to do a little bit here. Deep breath. Good job. Is it painful? It's really not, is it?
I don't feel a thing. You know me.
I know. And now we're going to do a little bit just in the center. And then we'll mold it a little bit while we're injecting too. She actually needs a little bit here in the center for the front projection, so we're going to do that. And every face is different. So on her chin was the main focus, so we started there. On other people, if the jowls are an issue, we may start on the jawline first. And I don't know if y'all can appreciate the change, but you can start to see how it's just sharpening and giving her more symmetry to the face by giving her more of a chin. That's good.
Good?
Yes, very good. We're going to come out here just a little bit. Deep breath. And I'm going to catch her. Okay, we're going to come out just a little bit farther. She's still got a little dip that we're going to correct right here.
I know, yeah. Oh, yeah.
Sarah, if you want to do the front, I think you can see it now. So, you can see how much sharper she is
Bump right here on the
from
side.
here. So yeah, that's the goal, is to give that softening and less of the shadowing. So she's going to have a total of 2 syringes in here. So between doing her chin and what we'll finish it off, which is what I'm going to do on this side, it'll take 2 syringes to get that full effect. Okay, so it's
It's gonna take for right up to here.
yeah, okay. All right, Miss Carol, a little pinchy here. Sorry, Sarah. It is Voluma. Yeah. And that's just that nice little finishing touch to just give her that lift. Okay, we're going to come around and do the other side. Oh yeah, that's pretty. You do need one more little dot right there. So, yeah.
Do you want it transferred or not transferred?
It doesn't matter. Okay. You want to work. So we did the first syringe with it in insulin syringes, which is sometimes just nicer. I'll take what's left. And then the final one we're going to do without it. It's simply more of a preference from the injector. So, a little pin. Are you numb now, Miss Carol? Mm-hmm. Yeah. She's at that point now where she's not feeling much. And we're all not symmetrical. So we all have a side that needs more. Yours is your left side. It is, and that's what I was saying, is there just, it's just a really preference of the injector, so I thought I'd just show it both ways. And she needed a little bit more on this left side of the chin. And one more, girl. Okay, and then what we're going to do is blend a little bit here and finish off with a little bit back here in the jaw. And with any filler, there's a chance of bruising. She's not bleeding much, but there's always the chance.
What does my artist think?
I think it's fabulous. I had a pretty easy canvas to start with.
Not true.
It is true. Okay, there's one little spot. Now we're just fine tuning. People always want to ask me how many injections it's going to take. There's no way to know until you start working. So, you just have to do it till it looks right.
Just the lower lip is 1700. That's the upper lip, lower
And
lip.
then we always give people after injections post-care with some arnica and even a little makeup kit and an ice pack just to help with the bruising or possible bruising. And definitely always some swelling. In her case, the lower face, she's gonna feel really tight. She's gonna feel like that she's had some dental work even though she's not had some dental work.
But I would love to have a filler on.
And she is done.
Wow.
That's awesome. That looks beautiful. And we like to, not all fillers will we massage, but on this one, I just want to make sure everything feels smooth and that there's no pops or bumps. Honey, you don't have a jawline now. No more jawline.
It does look good.
Doesn't it look
You
good?
can tell a difference?
Oh, yes. Looks very good.
So now she's much more sleek here, and her face is much more balanced because the lower face is so cut.
Yes.
So,
Very good.
thank you.